What if I told you that right now, as you're watching this video, your body might already be sending you warning signals? Quiet, easy to dismiss signals.
Signals that could be the difference between catching a deadly disease early or finding out too late. 537 million adults worldwide are living with diabetes. And 1 in 2 people with diabetes do not even know they have it. Over 500 million people. Walking around every single day. Completely unaware. Not because they were not paying attention, but because the signs they were feeling seemed normal. Ordinary. Easy to explain away. I am just tired because I did not sleep well. Of course I am thirsty. It is hot outside and I have been gaining weight because I have not been to the gym. Sound familiar?
Here is the thing that nobody tells you. Diabetes does not announce itself with a dramatic symptom.
It does not knock on your door and say, "Hey, I am here." It creeps in quietly, slowly. And by the time most people realize what is happening, serious, sometimes irreversible, damage has already been done to their kidneys, their eyes, their nerves, and their heart. But here's the good news.
If you catch it early, and I mean early, diabetes is one of the most manageable and in many cases preventable conditions in the world.
That is exactly what today's video is about. I am going to walk you through 5 early signs of diabetes that most people completely ignore. Not the obvious ones you have heard 1,000 times. The sneaky ones. The ones hiding in plain sight. The ones your body has been screaming at you, that you have probably been chalking up to stress, aging, or just feeling off. By the end of this video, you're going to know your body better than you ever have before. So stay with me. Grab some water, ironically enough, and let's get into it.
Welcome back to the channel. And if you are new here, welcome. This channel is dedicated to giving you real
information that your doctor might not always have time to explain in a 10-minute appointment.
Before we dive in, I want to say something important. This video is not meant to scare you. It is meant to empower you.
Knowledge is literally medicine when it comes to diseases like diabetes. The earlier you know, the earlier you act. And the earlier you act, the better your outcomes. Always. Everything I share today is based on peer-reviewed research, guidelines from the American Diabetes Association, the World Health Organization, and clinical endocrinology studies. I encourage you to talk to your doctor if anything in this video resonates with your personal experience. Alright, let's get into it.
Sign number 1. Extreme fatigue that sleep does not fix.
Let me ask you something personal. Do you ever wake up after a full 7 or 8 hours of sleep and feel like you barely slept at all? Like there is a fog over your brain that coffee does not clear? Like you drag yourself through the morning, hit a wall after lunch, and by 3 in the afternoon you feel like you could close your eyes and sleep for another 8 hours. Most people blame this on stress. On their job. On their kids. On Netflix, keeping them up. On life. And sometimes, yes, those things are the culprit. But sometimes, it is your blood sugar. Here is the science, broken down simply. Your body runs on glucose. Think of glucose as gasoline. Every cell in your body, your brain, your muscles, your organs, needs glucose to function. And insulin is the key that unlocks the door to let glucose into those cells. When you eat, your blood sugar rises. Your pancreas releases insulin. Insulin opens the cell doors. Glucose flows in. You have energy. But here is what happens in early-stage diabetes or prediabetes. Your cells become resistant to insulin. The key does not work the same way anymore. So even though there is plenty of glucose in your bloodstream, your cells cannot absorb it properly. The glucose stays in your blood, which causes high blood sugar. While your cells literally starve for energy, you are full of fuel that your body cannot use. The result? Profound, bone-deep fatigue. Fatigue that sleep does not fix, because sleep is not the problem. Your cellular energy production is broken. Now here is why people ignore this. Because tiredness is the most explainable away symptom in the world. We live in a culture that glorifies being busy. Being tired has almost become a badge of honor. "Oh, I am exhausted" is something people say like a greeting to us. Oh, when someone with early diabetes says, "I am just really tired lately," literally everyone, including their doctor sometimes, says, yeah, who is not? But here's the difference you need to know.
Normal tired means you are tired because you did not sleep enough or you have been busy or you had an emotional week. When you rest, you feel better.
Diabetes-related fatigue is different. You rest, and it does not help. It is consistent. It is disproportionate to what you have been doing. And it often comes with this mental fog. Doctors actually call it brain fog. where you struggle to concentrate, forget things more than usual, and feel mentally slow. It is also often accompanied by irritability. If your blood sugar is riding waves, spiking after meals and then crashing, your mood rides those same waves. You might feel anxious and jittery when sugar is high, then sluggish and irritable when it crashes, and the research backs this up. A 2020 study published in the Journal of Diabetes Investigation found that fatigue was present in up to 85% of patients with type 2 diabetes. And in many cases, it preceded the formal diagnosis by months or even years. Participants described this fatigue as unrestorative, heavy, and relentless.
So ask yourself this: am I consistently tired even after adequate sleep? Do I feel mentally foggy or struggle to concentrate for no clear reason?
Do I feel a dramatic energy crash 1 to 2 hours after eating, especially after carb-heavy meals? Has my tiredness been getting progressively worse over weeks or months?
Sign number 2, frequent urination and excessive thirst. I know what you are thinking. Everyone knows about the thirst and frequent urination thing. That is diabetes 10-1.
It is one of the classic signs. But here is what most people do not realize. Most people do not recognize it in themselves because it builds gradually. It is not like one day you wake up and suddenly you are guzzling 5 liters of water. It creeps up. You start needing an extra glass here. One more bathroom trip there. And before you know it, your normal has shifted dramatically and you have not even noticed because it happens so slowly. Here is why this happens in the body. When blood sugar rises above a certain threshold, roughly 180 milligrams per deciliter, your kidneys can no longer reabsorb all the excess glucose from your blood. So they start excreting it into your urine, but glucose drags water with it. So now you are passing more urine than usual, a condition called polyuria. And because you are losing more fluid, your brain sends the signal, dehydration alert, drink more water, so you drink. But the cycle continues. More sugar in the blood, more glucose in the urine, more water loss, more thirst. A healthy adult produces roughly 1 to 2 liters of urine per day. Someone with uncontrolled diabetes can produce 3 to 5 liters, sometimes more. And the thirst that follows can have people drinking 4 to 6 or more liters of water per day and still feeling thirsty. But people still miss this sign. Why? Because both of these things have such obvious, innocent explanations. Drinking lots of water. Well, you've been told to drink more water your whole life. 8 glasses a day. If you are now drinking 12 glasses, you might think, good for me, I am finally staying hydrated. Going to the bathroom a lot? You tell yourself it is because you are drinking more. Or you had coffee. Or it is just how your body works now that you are getting older, and the nighttime urination, called nocturia, is one of the most missed signs. If you are getting up 2, 3, even 4 times per night to urinate, and you have started to assume this is just what happens when you get older, please hear me clearly. That is not normal. And it warrants investigation. Watch for these signs. Are you urinating more than 7 to 8 times per day? Are you waking up at night to urinate more than once? Do you feel thirsty even right after drinking water? Is your mouth persistently dry? These are signals your body is sending you. Do not ignore them.
Sign number 3, blurry vision that comes and goes. How many of you have experienced moments where your vision suddenly goes soft, a little blurry, and then, just as mysteriously, it clears up?
You probably blamed it on screen time, or tired eyes. Or maybe you figured you needed glasses and made a mental note to book an eye appointment and then forgot. But here's something your optometrist might not immediately tell you. Fluctuating blurry vision is one of the earliest signs of blood sugar dysregulation. And it is one of the most frequently dismissed. Inside your eye, there is a lens, a flexible, transparent structure that adjusts shape to focus light onto your retina. That lens is surrounded by fluid, and changes in that fluid affect the lens's shape and its ability to focus. When blood sugar levels spike, that fluid becomes more concentrated with sugar. This changes the pressure inside the eye, causing the lens to swell and change shape. When this happens, light does not focus correctly on the retina, and your vision becomes blurry. When blood sugar drops back down, the lens returns to its normal shape. Vision clears. This is why people with early, undiagnosed diabetes often describe vision that comes and goes. It is literally fluctuating with their blood sugar levels. Now, the fluctuating blurry vision in the early stages is mostly annoying but not dangerous. However, and this is critical, if blood sugar remains elevated over months and years, diabetes causes something far more serious, Diabetic retinopathy. Diabetic retinopathy is damage to the blood vessels in the retina. It is the leading cause of blindness in working-age adults worldwide. The terrifying part? Diabetic retinopathy has no symptoms in its early stages. You will not feel it. You will not see it coming. By the time vision loss starts to occur, significant damage has already been done. The blurry vision you experience early is your warning window. Do not ignore it. What should you watch for? Blurry vision that occurs sporadically and resolves on its own. Vision that seems worse after eating a big meal or sugary food. Difficulty focusing on text or screens at certain times. Colors appearing slightly washed out. And any sudden significant vision change, which warrants immediate medical attention. If you are over 35, overweight, have a family history of diabetes, or are experiencing any of these vision changes, please get a comprehensive dilated eye exam. Not just a standard vision test. A dilated exam allows the eye doctor to see the blood vessels at the back of your eye and detect early damage long before vision loss begins.
Sign number 4, slow healing cuts, wounds, and infections. Think back over the last 6 to 12 months.
Have you had a small cut or scrape that seemed to take forever to heal? A bruise that lingered much longer than it should have? A skin infection that kept coming back? Athlete's foot that just would not go away? A gum infection? A yeast infection that recurred multiple times? If your answer is yes, and especially if this feels like a pattern rather than a one-time thing, your body may be telling you something crucial. Here is why diabetes destroys your healing ability. And it happens on multiple levels. First, high blood sugar impairs immune cells. Your immune system's primary foot soldiers, white blood cells, need glucose to function. But in a diabetic environment, these cells become insulin-resistant too. They cannot absorb glucose efficiently, so they function poorly. They are slower, less effective, and less able to fight off infection. Second, high blood sugar is literally food for bacteria and fungi. Pathogens thrive in high-sugar environments. When your blood sugar is elevated, the sugar feeds the organisms trying to infect your body. This is why people with uncontrolled diabetes get infections more frequently and struggle to clear them. Third, damage to blood vessels reduces blood flow. One of the earliest effects of chronic high blood sugar is damage to small blood vessels. When blood flow to an area is reduced, the nutrients, oxygen, and immune cells needed to heal a wound simply cannot get there efficiently. And fourth, nerve damage creates hidden injuries. High blood sugar also damages nerves, a condition called peripheral neuropathy. This is particularly dangerous in the feet. People with diabetic neuropathy can develop cuts, blisters, or ulcers on their feet and literally not feel them. By the time they notice something is wrong, the wound has become infected, deep, and potentially severe. This is why diabetes is the leading cause of non-traumatic lower limb amputations worldwide. It starts with wounds that will not heal. The healing problem often starts subtly. That paper cut that took 2 weeks to heal instead of 5 days. Recurring yeast infections. Recurring urinary tract infections. Gum disease or slow-healing mouth sores. Skin infections that keep coming back. Many people are embarrassed about wounds or infections that will not heal. They feel it might be a hygiene issue, or they're afraid to see a doctor about something that seems small. So they treat it themselves for months before seeking help. If you have a wound that is not healing within 2 weeks, or any infection that keeps returning, especially on the lower extremities, please see a doctor. That is what doctors are there for. Sign number 5. Tingling, numbness, or burning in the hands and feet. Have you ever experienced that pins and needles sensation, the one you normally get when you have been sitting on your foot for too long, but it happened for no apparent reason? Or maybe you have noticed that your feet sometimes feel slightly numb. Or that you get a burning sensation at night that makes it hard to sleep. Maybe you have told yourself, my circulation must be off. I slept on my arm funny. It is probably just anxiety, and it could be those things, but unexplained tingling, numbness, or burning in the extremities, particularly the hands and feet, is one of the hallmark early signs of diabetic peripheral neuropathy. And it is one of the most chilling signs to know about, because once nerve damage has occurred, it is very difficult to reverse. Here is how the damage unfolds in the body. When blood sugar is chronically elevated, glucose enters peripheral nerve cells and triggers a cascade of chemical reactions inside the nerve cell. These reactions produce reactive oxygen species, essentially chemical sparks, that damage the structure of the nerve fiber over time. Simultaneously, the small blood vessels that supply oxygen and nutrients to nerves are damaged by high blood sugar. Without adequate blood supply, nerve fibers slowly deteriorate. Nerves are also wrapped in a protective insulating layer called myelin, much like the rubber coating on an electrical wire. When myelin breaks down, nerve signals become erratic, firing when they should not, causing burning or pain, or failing to fire properly, causing numbness or loss of sensation. The result is peripheral neuropathy. And because the longest nerves are affected first, the symptoms almost always appear in the feet and lower legs before eventually progressing upward and affecting the hands. Doctors call this the stocking and glove distribution because the numbness and tingling affects the parts of the body that would be covered by stockings and gloves. Early symptoms include tingling like pins and needles in the toes or fingers, mild burning especially at night, and increased sensitivity, where even light touch can feel uncomfortable. Later symptoms, if unaddressed, include complete loss of feeling in the feet, inability to detect injury or heat, loss of balance and coordination, and severe pain especially at night. The tingling in the early stages tends to come and go. It is often mild, and because it comes and goes, people rationalize it. I probably pinched a nerve. My vitamin B12 might be low. I need to exercise more. And here's the thing. They might be right. B12 deficiency, poor circulation, and other conditions can also cause these symptoms. But that is exactly why you need to get checked. You need to find out what is causing it, because if it is early diabetic neuropathy and you catch it now and you bring your blood sugar under control, nerve function can be preserved and even partially restored. But if you wait until you have lost full sensation in your feet, that damage is largely permanent. Let us bring all of this together. The 5 early signs of diabetes most people ignore are: Number 1. Extreme fatigue that sleep does not fix. Your cells are starving for energy they cannot access. Number 2. Frequent urination and excessive thirst. Your kidneys are dumping excess sugar and pulling water with it. Number 3. Blurry vision that comes and goes. Fluctuating blood sugar is changing the shape of your eye lens. Number 4. Slow healing wounds and recurring infections. High blood sugar is feeding pathogens and impairing your immune response. Number 5. Tingling, numbness, or burning in the hands and feet. Early nerve damage from chronic glucose toxicity. None of these symptoms are dramatic on their own. Each one has a dozen innocent explanations. That is precisely what makes them so dangerous. But together, or even 2 or 3 of these in combination, they paint a very different picture that if you have been listening to this and nodding along, please do not brush it off. Here's what I want you to do. Step 1. Book an appointment with your doctor. Ask for a fasting blood glucose test and an HbA1c test. These are simple blood tests. The HbA1c gives a 3-month average of your blood sugar levels. It is one of the most reliable tools for detecting prediabetes and diabetes early. Know your numbers. For fasting glucose, normal is under 100 milligrams per deciliter. Prediabetes is 100 to 125. Diabetes is 126 and above. For HbA1c, normal is under 5.7%. Prediabetes is 5.7 to 6.4%. Diabetes is 6.5% and above. Step 2. Assess your risk factors. You are at higher risk if you are over 45 years old, overweight or obese, especially with weight around the abdomen, physically inactive, have a parent or sibling with type 2 diabetes, have high blood pressure or high cholesterol, had gestational diabetes during pregnancy, or are of African, Hispanic, Asian, or Pacific Islander descent. Step 3. Make lifestyle changes starting today. Reduce refined carbohydrates and added sugars. Increase fiber intake. Move your body. Even 30 minutes of walking 5 days a week significantly improves insulin sensitivity. Prioritize sleep, because sleep deprivation directly impairs glucose metabolism. And manage stress, because cortisol raises blood sugar. That I want to leave you with this. Diabetes is not a death sentence. Millions of people live full, healthy, vibrant lives with this condition because they caught it early, because they made changes, because they did not ignore the signs. You now know what to look for. Your body has been speaking to you.
this video helped you, or if you think it could help someone you love, please share it. A share could genuinely change someone's life. I mean that. Which of these 5 signs surprised you the most? I read every single comment, and I will be responding this week. Thank you so much for spending this time with me today. Take care of yourselves. See you in the next one.